Hello, Fergus Timmins here again with a short presentation on communication tips and tricks. Okay, so we saw in the earlier part of this topic the importance of verbal and non-verbal communications. So we want to talk a little bit about how we can improve communication between yourself and the loved one that you're caring for who has dementia. Okay, so what I want to do in this short presentation is look at some very simple overview strategies, looking at how we can substitute statements for questions and substitute actions for questions and how these can actually help with communication. We're going to look at some very simple visual cues, and we're going to finally talk about the importance of listening. So in terms of strategies to improve communication, let's look at non-verbal communication first. Eye contact is so important. So if you're talking to your loved one who has dementia and you don't establish that eye contact, you're not fully engaged with that person. Of course, all of this depends on the relationship you have with the person with dementia, the stage that the person with dementia is at, and the symptoms that they're exhibiting. So please bear that in mind as you go through this presentation. But eye contact can certainly establish good communication, trust, and attention. And it's important actually to make sure that you gain the attention of the person you're speaking to before you try to communicate with them. Now that might be something as simple as touching their arm or saying their name to make sure that they are in the zone with you. It's also important to try to interpret the person's non-verbal communication. And this could be something as simple as you might notice that they've got a frown, or that they look pained, or they're hunched, or they're quiet, or more quiet than normal. So try and interpret that. A frown on the forehead could be that they're in pain, they might need something. Your tone of voice is really important. Your tone of voice is really important in establishing the communication strategy that you're trying to put across and in gaining their trust. Make sure you speak slowly and say individual words clearly. Use touch if appropriate, as I mentioned before, and use visual cues, and we'll come back to visual cues in a couple of minutes. But really, it's important also to be realistic in your expectations in terms of what you're trying to achieve through the communication. And again, that may depend on the stage that the person with dementia is at with their dementia. Verbal communication is important. Begin by identifying yourself and explain what it is you propose to do. So try and get that balance between informality and being relaxed, but also being clear in terms of your communication needs. Give short explanations and paraphrase. So you could say something like, "We'll put on your coat because we're going outside," rather than, "Now, Dermot, we need to put on your coat because your wife is coming over and the weather forecast is pretty bad and she wants to take you to the garden centre." Keep it short, keep it clear. And use the language that your loved one uses. So encourage talk about the familiar. Use their phraseology. So they might talk about going to the toilet, they might refer to that as spending a penny. Use their language. It's familiar and it's comfortable for the person with dementia. Substitute statements for questions. So pointing at things while you're saying it. So for example, saying, "Here is the toilet," pointing to the toilet door, rather than repeatedly asking your loved one, "Do you need to use the bathroom?" That can be confusing, it can be embarrassing. So keep it casual and keep it simple. Keep it simple. That's really important. Keep it simple. And again, this is all in the context of the stage and the symptoms that your loved one is exhibiting. Substitute actions for questions. So you could demonstrate or begin a task, for example, washing your hands or brushing your teeth, in front of the person rather than again giving an instruction. Giving an instruction can be difficult if the person doesn't understand the words. So using actions can be appropriate and helpful. Use visual cues. And again, of course, depending on the stage of the dementia, written notice or pictures may be effective to orientate the person. So you could put signs on the toilet door, on the bedroom door, and in the kitchen on the various cupboards and drawers. And you'd be amazed at how well this works. Finally, the importance of listening. Affection, respect, gentleness of touch can soothe and reassure a person with dementia, especially if they're confused or disorientated. Even if we don't understand the person, if we listen with interest, the person will sense empathy. That's so important. This will impact positively on the person's confidence and self-esteem. And again, communication is all about self-esteem, empathy, confidence. And if you follow some of these tips, at least try them and report back in the forums how you're getting on. Okay, that's it. Thanks for listening and thanks for watching.